Waiting for a few more people to join, and then we can
I've sent a reminder on the Telegram group. Do you think it's a good idea to send one on email as well? Since not everyone's on the Telegram group, I think.
a reminder on email.
Yeah, reply to the same email saying. Yeah.
Okay.
I have a question. Are we being live streamed somewhere?
Yes, we're being live streamed on Facebook.
Okay, thanks.
Right, so I think we should start with, since we also might have some people watching from Facebook. So hello, thanks for joining us today. We're here with Ricket Shai. I think most people must be aware of who Ricket is, since he's been volunteering throughout the pandemic. I think people might be aware, but in case you are not on Twitter and in case you haven't seen our social media, Ricket is a fourth-year law student based in Hyderabad. Apart from leading the local representative program at YF, Ricket has been involved in many relief efforts and has a long history of volunteering, from helping laborers migrate during the first wave to raising funds for families affected by the Hyderabad floods to working at a Delhi-based Legal Aid Foundation. He has been helping people navigate crisis-like situations throughout the pandemic, and we're so happy to have you here, Ricket. So first of all, how are you?
Good. I'm surviving.
Uh-huh. So how have the past 2 months been in terms of COVID-19 work, the work you're doing on ground, the relief work? How have the last 2 months been?
So on the day I go out, my back and knees hurt. And the day that I am sitting in my house, navigating through Twitter or my notebook, my eyes hurt. So
That's how
it's
it's
just overwhelming.
It's overwhelming. So what do you do with the notebook and Twitter? Like how do you manage?
Okay, right now, Twitter is not much of a huge resource of sorts. But during the wave, the peak, a lot of requests came on Twitter, as in it was more or less a resource of sorts, a huge resource of sorts for people to put out SOS requests and seek help for different things, be it a bed, ambulance service, or even as bad as something like cremation. And the only purpose that it served was to find a request and patch them with someone who could help. So, and even right now, when we are when the peak is going down, you have people looking out for help regarding post-COVID complications and blood requests that are in huge number. So that is how it is precisely right now.
So what do you do with your notebook exactly? So you mentioned that you work with your notebook and your phone.
Okay.
So I want to know what exactly are you doing with your notebook?
So huge. Largely, the notebook serves as a this thing. I note down numbers and any other requirements that people ask for, because on the Twitter or maybe on WhatsApp, it becomes difficult to keep a track. So having a notebook, it just helps to know who wants what, like something of this kind. You can just see numbers here. That is how it works. And as each and every request starts getting over, I keep striking them down. So this entire notebook is served for that purpose.
So you have all of these contacts, like the hospital, the suppliers, chemists, and people who need help, and then you just like locations written down and all.
Yeah, kind of. So initially it started off because a lot of plasma requests, like right now, plasma therapy is not being allowed by the ICMR. But when it was being allowed, there were numerous requests, especially from Maharashtra and the Mira Bhayandar region, and anyone would call and ask for a resource from there. So what I do is I take a note of that patient details and try to search for a resource. A friend of mine, Divya Jain, who's based in Delhi, had started a website. So when I found out that she's working on this, I got on board with her. So what we used to do is we used to look out for requests, and then from the database that we'd receive on the website, we'd patch the donor details to them. So keeping a notebook helped coordinate better.
Right. So how did I think you answered my next question to a certain extent, but so now because you've been maintaining this notebook for a while, do you have these specific hospitals, specific people you approach? Like, have you tried any helplines? Do helplines work?
No, so here's the thing, like when you said ki if I have a note of hospitals in other places, they had practically become redundant, I think sometime around April 3rd week.
Mhm.
So there was no point noting down hospitals and their details, like dashboards and other things. I tried them in the first week or something. And like there are a couple of hospitals near my house itself. So I would call them and ask, ki, do you have a bed available? The dashboard of the Telangana government says X number of bed available. So they just immediately tell me that no beds available. And then I'd come back to quoting the number. So they'd tell me ki, that must be a technical error. We'll have it checked. And for 3 days, the same number would be shown on the website, but you don't have a bed available. So that did not help.
Right. So people who needed help might not really be able to rely on these dashboards. They'll have to rely on people like you. I mean, you become more reliable than these hospital dashboards and government officials because you are updating regularly, whereas they aren't.
Uh, no, so I don't think that is exactly the case. Like even we were not able to update ourselves. Like the couple of people, especially based in Hyderabad, one goes by the name of Mr. Charan. Charan tweets as his Twitter handle. So he is kind of a person who had contacts across hospitals. So it was proving to be difficult for him also. So that was a time where it was like more or less an apocalypse, if that is how it's spelled. You didn't have any beds practically. So that 2 to 3 week time, everyone had put up their hands. So the no beds practically, just nothing available.
So what were you doing? So if someone calls you during that time asking for a bed, what exactly do you do? What are your next steps?
So initially it was a lot of panic ki how to help because there are no beds available. You just keep scrambling here and there and you find nothing. But later, so the friend in Delhi would help me with other things like proning techniques and other things. So we'd make a message and we'd pass it on to them. In the meanwhile, when we would look for resources, and after a point in time, it also became easy to set up these things at home. So
Mhm.
try and help people set up things like these at home, like oxygen or even say a concentrator if they were in the initial stages of the infection, or if it's getting critical, ICU at home itself. But again, uh, not everybody at that point in time was able to get any resource that they'd want. So I think
Mhm.
it's like a huge void of sorts, which I think is best left for a researcher or a journalist to document for later generations because,
There was nothing.
yeah, precisely.
Right. Also, because I've been following you on Twitter for a while now and following your work for a while, I noticed that a number of political leaders replied to your initial tweet when you first said that you will be helping people with their regular things of need, their necessities. I noticed a lot of people in politics who responded to your tweet. So, did you receive any kind of help from them, or did you approach them? Since they must be seeing your tweets, they must have followed you perhaps, or they must be seeing your tweets through their mutuals. Did you ever receive any help from someone in politics?
So on that particular tweet that you mentioned, I didn't per se seek any help there. But in general, when I put out a request, so again, the span of time I told you, those 2 weeks, if I put out a request, I would eventually get help. Like there's a specific instance where a person reached out to me from somewhere, like they got my number because it was floating on the internet. And so they called me and they said ki their aunt requires a ICU bed or a bed in general because they're pregnant, 6 months pregnant, and her oxygen levels have dropped to 60. So at that time, again, like I told you, every hospital was telling they don't have beds. It already put their name in waiting list. So again, this was also something that had started where names were being put on a waiting list. Like if for a ventilator, it was being put on a waiting list. Even for a general oxygen bed, you were being put on a waiting list. So in that situation, I did not understand what to do. And for me in general, getting on Twitter is the last resort because in general, I know that there are hospitals, I know there are numbers available on the internet. So that is going to be my first course of action.
Mhm.
And Twitter, I reached out to Twitter first, sorry, at last, because there's nothing available practically. So the tweet got amplified very soon, like within a matter of 16 minutes. And two people like Sunita Krishnan ma'am, she is a Padma Shri awardee and she's based in Hyderabad. She reached out, and the Minister of Health of Telangana, the then like he's resigned now, but when he was there on that position, he responded and he sought for details. And when I shared the details with him, I was told ki they can be taken to XYZ hospital, like Gandhi Hospital. That's the designated COVID hospital in Hyderabad. And so I shared the details with the family. I sent them a screenshot of the tweet interaction that I had with the minister. And as soon as the family reached there, the only thing that they did was just show the screenshot to the reception, and a bed was reserved. And later, the minister themselves they followed up on Twitter mentioning कि falana number ka bed has been allotted to your patient and XYZ person is taking care of them. So that was kind of weird. Like in the beginning, it felt very nice. Ki even a medium like Twitter is uh, helpful in getting a response of this kind and getting a follow-up response further. Like that would be an ideal situation you'd expect in real life. So yeah, it was nice to matlab, get a response in such a short span and matlab, to help people. Nothing better than that.
Also, since you said that your number was floating around on the internet, where exactly was it floating around? On these Google Docs and spreadsheets, or
Yeah, so what happened was initially so everything started by me putting out a tweet that I'm ready to run errands for patients in isolation in and around Khairtabad. That is the place where I live in. So a couple of people asked for my number and I readily shared because I thought they were in need. And I guess 3 or 4 days later, I I started getting calls right from 8 a.m. in the morning to like 2 a.m. in the night, like including WhatsApp messages. And a couple of websites put out my number as a plasma helpline for Mira Bhayandar region in Maharashtra. And that region was at
oh,
its peak, at its worst at that time. So if I'm anywhere, like even if I'm going to sleep at night 2 a.m., I'd get a WhatsApp message or a SOS call ki we need it at any cost, please help us. So yeah, that is how it happened, I guess.
mm, right. I was wondering, since your number is everywhere on the internet now, I think you might even receive requests going ahead in the pandemic if there is a need. So once you get into this once you are a COVID-19 volunteer, there is a very little scope of, you know, withdrawing from that responsibility. It becomes a long-term responsibility.
Yeah, precisely. And there's also this thing that uh, I had initially specifically spoken of helping with running errands and not any other things. But I don't know how it works, but people tag you and send you messages of all sorts. Ki they need ICU, but they need remdesivir or right now liposomol or even the Crisamba injections. So you just cannot say no. Matlab to me personally, it feels weird to say that no, I cannot help you or I'm not aware. So just try beating your hands and legs matlab, in some way or the other. It's like floating in the ocean with one hand and one leg tied, and you're just trying to beat your
Get
hand and make sure
yourself
that you
anywhere.
survive. Yeah. So
I
and
think
it
there are
worked
also,
out,
mm,
and it worked
it,
out so far. So
mm,
no other
they might have
option.
also reached out to you out of sheer desperation, right? Because nobody to help, and I think I understand that situation there and anything you did to that. That's great actually that you started with something so small as errands and then you grew to plasma and oxygen cylinders and all of that. And
Yeah.
so since we've been speaking about what you've been doing during the pandemic, I think the severity of the situation is also a consequence of how little has been done from our institutions and institutional failure, right? So, as someone who has been on the ground, what is your opinion on the institutional response to the second wave? Did you feel there was an excessive burden on civil society organizations, on people like you, individuals like you?
So I guess starting right from January itself, I doubt that we as a country or matlab, our people as a government were ready or they foreseed it. I am not aware exactly of any international examples of a second wave coming, but we clearly had put our guards down, and that is why we had huge events in terms of election campaigns or even uh, matches, sports matches happening with full strength.
Mhm.
So that letting that guard down there and thinking that like underestimating the severity, I'd say no one could estimate the severity, and more than anything, uh, we let our guards down precisely. And yeah, I mean, it feels a little uh, weird. I think I'm not, or rather insensitive to say, or rather speak of that because we're still not over that phase yet. So, yeah, we're still not prepared well.
But as someone working on the ground, did you ever feel like had you had some support from, say, a local political leader, things might have been much easier for you? I mean, you just one person maintaining something like a register of numbers. That should be done on, that should be a database. I mean, that is a database, but that should have been a government database and not an individual's notebook. I mean, that
So,
is a failure right there.
yeah, so the aspect of political leaders that you spoke of, I know quite a few of them who were on the ground, but their resources were also limited, as was the case with the public authorities. So again, in that situation, also, I'm not sure how much they would be able to do, and that also is in a way because of their failure. And again, like even if you've been put in that situation, it's impossible to expect from them. And I don't say it as a matter of showing sympathy for them, but you cannot expect them to matlab, do it in a minute. They were supposed to do it maybe from the last year and
Mhm.
they failed to. So to speak of or expect any help at this point is just like uh, unwarranted. And I
It's
mean, I've lost
pointless.
hope from politicians.
Yes.
I don't. So I don't consider, I mean, it's just like a heartbreak of sorts. So the less spoken, the less better, I guess.
Mhm. I think that speaks a lot. I mean, now that we've sort of, I think we haven't concluded. I think people have known for a while that the government has really failed. What is the one thing you think they could have done differently to make things better for us? I mean, what is that thing that you felt that अगर ये हुआ होता तो आज situations बहुत better होते या शायद आज ही this kind of work बहुत easy हो जाता?
So, in my understanding or experience, August to October was a phase where I think things were bad. They were not very good even then. And if at all we had uh, foreseen it, or even after foreseeing it, put our money there in the budget,
But
provisioning for things, making sure that at least we have a backup of sorts. But there was nothing absolutely. I mean, it it seems like a cruel joke of sorts to even discuss when there was absolutely nothing. Like you can discuss anything if there is something or the other left, but in a situation where code was not even your priority, like you were busy with elections in different parts, and I don't know, matlab, it's a very difficult question to be able to answer when there is absolutely nothing at all. Like COVID was not on the list of agenda itself. So yeah.
Mhm. um, right, that makes sense. Also, now since you have also been a volunteer, What do you think about the way that the government, the central government, has reacted to the relief efforts of the Indian Youth Congress? I mean, I've been following Srinivas Devi and other members of the Youth Congress for some time now, and they have received some backlash from the government. So, what do you feel about that? And while you were volunteering, were you ever stressed that there might be some kind of a backlash from the government that they might not respond well to what you were doing?
So it was kind of ironical because largely the work that even the IYC team or even the civil society or volunteers in general were doing were bridging the gap wherein
What do
administration
you
was not able to bridge it off between resources and accessibility. And it felt like the government was cutting the arm, that the artificial arm that was provided to them when their arm was not working. So that was sad. And I think there was a lack of understanding or even gravity of the situation was not assessed properly to be to do something of that sort. And as for the backlash, I have personally faced something of this sort, like not exactly of this nature because they were practically called to the office, so the officers were visiting them to inquire. But this was sometime during when I was engaged in the legal aid for Delhi riot victims,
Mm.
and the NEC commission was formed, and they had refloated the riot compensation forms. So I was tasked with a list of people who needed help in terms of filling those forms, and I was calling them one by one. And I called one such person, and he told me that he'd call me back, and he called me back, and his tone had completely changed, and I still think of it like every night. Ki, what happened then? So he was suspicious of me for some reason. After first agreeing to share all details, and the next day I get a call from a person claiming to be a special crime branch officer. And at first, I was very startled because I have anxiety issues. So I somehow managed the call, and I still thought it was a prank call. But I went to the internet, I checked for the name and through other sources, and it was an actual special crime branch officer calling me. And all for the fact that I was just trying to help that individual fill a form. And I wasn't even aware that that person is a designated witness. This was something that was told to me by the officer himself, ki you are threatening a witness.
Mhm.
And so that was something that I expected, like that was not something that would surprise me. But yeah, of course it just saddens you that you're trying to do something and someone is just pulling you back. And what is further saddening is that the person who's pulling you back was supposed to be the person who would do the work in the first place.
Mhm.
So yeah.
But why do you think this happened? Because they didn't want you to help, or what? What was the reason?
So again, I'm not too sure if it's right to speak on this a lot, but those riots were communal riots in nature. So I think,
Perhaps that is why
yeah,
they drew a link there or something. Yeah,
precisely.
it's strange that it's not even safe to speak about it, but I understand why you think so, and I think so too. Um, right. So volunteering for 2 whole months. Now it's been 2 months, right? You had posted the initial tweet in April, I suppose, and now it's almost been 2 months. So volunteering for 2 months must be tiring, since you spoke about your, body aches and eye pain and all of that. What, I mean, apart from a physical toll, since you are a student, what kind of a personal toll has it taken? And has your college or your place of study been supportive of your work? How has your university responded?
So practically, I've been away from education since September or something. So my my family was affected in around September, and since then the volume of the shock and the entire events that followed since then were so huge, and it still continued until February. So I never was in the right frame of mind to matlab, go back to education or even think of it. And I'm still kind of away. Although like in the past 2 days I decided to go back because I had exams, which again got postponed. So back to square zero. So in terms of education, everything is fallen back. And I know for a fact that sometime I'll be able to gather because apart from anything else, I have this immense privilege, which I have to acknowledge. So I know ki I can go back and it will not be a problem for me then. But anything of everything that I'm involved in right now, I cannot go back to it later. Like it's a time of crisis, and just staying here, putting my hands and legs here, can be of more help than matlab, thinking of my personal life. So yeah.
Mhm. But has there been any supportive response from your university that they might allow you to, um, if you've missed something, they will allow you to recover it or something like that?
So in terms of assignments since September, my college has been supportive in a way,
Mhm.
but I think I limited to that because apart from that, there was no support at all, and it felt like uh, we as students are not facing any crisis, and there was this two-line whip of sorts every time you reached out to any person for help, like regarding education, that at any way you're just sitting at home watching Netflix in Prime, so how does it matter? So after that kind of response, you don't even feel like reaching out because uh, so I study in a private institution, so I don't expect a lot of help after a lot of sequence of events that have happened. So yeah, again, a lot of helplessness and matlab, just not expecting anything.
Right. Why did you decide to do this kind of relief work since it has put many things in peril? Why did you decide to do it, and what moved you towards it? Was it just the situation, or was it something personal? Why did you do this?
So the multiple reasons of sorts. So on like to speak honestly, I'm not a very good student. Matlab, like in terms of education, I'm just an average person, and I don't really like the academic part of it. So and I don't fare well at it. So I feel matlab, there's no point matlab, putting myself there and again. So I instead turned to different things like which I thought I could do. And so my college is in a rural area, and just listen to those stories of people of from their past or anything else would move me a little bit. So just try to help them in a small capacity where I could bring them a lunch or matlab, just eat with them. So something of that sort showed me my place in a way ki, uh, for all the things that I thought that my life was the worst or something of that sort. Matlab, in the teenagehood, you have these things in your mind, these ideas in your mind, but when you actually see or meet people who
Mm.
have probably faced worse things than you, matlab, again, you have a reality check of sorts. You realize the kind of privilege you have,
Mm.
and yeah, so I've lost people who I thought were very dear to me, and I got along with them, but to not being able to just meet them in the 1 year and then to just find out that they're no more with you, you'd not want that thing to happen with someone else. So yeah, matlab, you just know that this is life threatening to say the least, and anybody to lose their loved ones, just heart aches. So matlab, don't want that to happen with anyone.
Right. That was. Thank you for opening up so much to us. I know it is difficult to speak about it right now because it is happening as we talk. It's still happening. It's not as if um, things have bettered substantially. So thank you for opening up so much to us. Um, Before the second wave, um, what other voluntary social service have you been doing? What have you done? Because I know you for a while and I know you're deeply involved in such work.
So right before the second wave, we had floods in Hyderabad. I think that was sometime around October. But the effects were as such that the work continued until December because you first had to save people in the immediate situation, and then you had to make sure that they were rehabilitated, or just before rehabilitation, you made sure that they had roof over their heads and they had something to eat on a daily basis. So it first started off with plan for a longer term where we could assess the loss that has been caused. So we set out on creating a form of sorts, which people would later, after the entire relief efforts of rehabilitation were over, they would go to the places and take a note, do a survey, like on ground survey. So that was the plan initially. And later, everything moved to making sure that relief kits and other resources are provided to people in need. And largely, so this was something that was on ground and physical. So making those kits and all that, and to cover a large proportion of area, I think approximately uh, 10 lakh families, if I'm not mistaken, or maybe at least 10 lakh individuals. I think 10 lakh individuals would be a right number. So making kits for them and packing and asking for people to come and donate these things at the center in Banjara Hills, that was approximately the 1 month schedule. So we packed those bags and made sure that they were delivered, and creating that form for survey. So
But you were
precisely
not doing this alone, right? You had an entire group of people. You were um, managing the whole thing. Were you working with an organization?
so so here's the thing that has happened, I think, in the last 1 year, when you've had any and every kind of calamity, whether natural or man-made count, that uh, one organization is not like, there's no standalone organization that's working. And the same was the case with this one. There were approximately around 14 to 16 organizations that came together, who had different kind of expertise or different kind of know-how. So they pooled in resources, and a call for volunteers approximately all around Hyderabad was made, ki devote your 4 to 6 hours on a daily basis, or even on the weekends if you're able to come, but just come and help, because we need hands and resources. So it was just largely, like I told you earlier, uh, the work of any public authority or administration largely is to bridge that gap of access and necessity. So I think that is what these 14 odd organizations were doing right then.
Right. And do you have anything to say about the government coming down on civil society organizations? I mean, we also heard about Amnesty closing down last year, um, closing their operations in India. But apart from that, do you have anything to say about, because the government is not really fond of NGOs and not non-profits?
Uh, so it's like this. A couple of months or weeks ago, you were the same person who were telling ki uh, NGOs are bad for the health of democracy or something on those lines. And right now, everywhere, like right now, like if I start from my house and go along the lines of the streets until a couple of hospitals, government hospitals, I'm only going to see civil society members and normal volunteer, like my classmates volunteering and delivering goods or any kind of food or other relief material. So this was the arm that you thought was poisonous and you were cutting. So the arm is not gone yet, so you can maybe still save it through the infection. So
Mhm. That's a nice metaphor you've got there. So, I mean, this was huge, this helping families during a natural disaster and ensuring that they have, as something as small, as basic as a roof over their head, something to eat. This was a huge thing. And apart from that, I also read that you've been working with a Legal Aid Foundation in Delhi.
yeah,
Do you mind telling us about that?
yeah. So that was specifically for the period of August to December, when uh, things had gotten a little better with the pandemic for them. And just before the pandemic is when the riots had happened in Delhi. So the pandemic coming up and the lockdown that caused the migrant influx, I, it was the worst kind of thing that could happen to anybody that was affected through the riots in Delhi. So the immediate efforts that were there were to make sure that they immediately received something in form of any kind of monetary or other aid from the government, so as to help them going. Because again, but I cannot go into a lot of details because the entire all of these cases are sub judice currently, but that was the effort to make sure that they get aid. So there was strategic litigation and a part of it still going. And the cases where they had received no help at all, like even after the assessment that the SDM or the DM was supposed to convene, the report said, or they were just told on their faces, ki you will get no compensation. Or for losing the entire building, your only compensation is 11,500 rupees. So there had to be a lot of paperwork that had to be done, and it's not the case that everyone has received help even now. So, and sadly, that is going to be a very long process for someone who's lost their everything. They've even lost their family members, and they had to face the brunt of the lockdown and pandemic, and then until here. So again, matlab, you've been left with nothing to say except for the fact that you could have foreseen this, you had foreseen this already, or you were supposed to foresee this and make sure necessary aid was provided, but you just chose not to, and nothing can be worse than that on part of a state.
Right. I mean, there really isn't much to say. It's really obvious and very explicit what they did, and I think everybody just sees it at this point. There is no need to really put it out there. People know. And this was the same thing you did. So, working at this Delhi-based Legal Aid Foundation, you have also helped migrant laborers. This was the same thing.
No, so the migrant labor thing was entirely a students-led, like law students-led effort prior to August. So sometime around, it started sometime around in April, when April or May, April, May end, and continued until June, when migrants were returning, or were rather forced to return. So that was the effort then, where again, like I said earlier, the gap between the access and necessity which the administration is not able to bridge, at that time students were bridging. Like at different points, you have people from outside the government, like students or general volunteers or civil society organizations, coming to the rescue. Because ideally, again, that is the very job of the state or the authorities to do that. So yeah.
So, with the migrant laborer situation, with the student-run effort, what exactly were you doing? So,
So, in terms of context, this is what had happened. A lot of law students who first foresaw this situation, they reached out to a few authorities based in Maharashtra and Madhya Pradesh largely, which later on expanded to different states. So, what they did was they were given a lot of data of migrants who had registered on different helplines and who wanted to return to XYZ place. So, it was like a huge database of Excel sheets, and where we had to make calls to people who wanted to return from X place to Y place. So largely, I was uh, catering to requests from people who wanted to return from Pune and other places in Maharashtra to places in Mumbai, or from say Delhi to UP. So we had to call them up, tell them ki you had registered, and are you still willing to go? If you're still willing to go, where are you right now? And if you can reach at Falana time, at XYZ time, to this train, because the train is scheduled then. So if they would confirm, we would compile that data and send it back. And again, we would be sent with a new set of instructions that you have to call them and tell key at this point in time, they have to reach at this X gate, and a train, or rather a bus or a pickup service, would be provided to them for XYZ location. So a
who
lot
is
of
this person
followers.
telling you that the person telling you that they have to reach XYZ place at this time? Who is this? It is the administration.
Yeah, these this was the administration of the local place, the respective states that the migrants were returning from, or yeah, returning from.
So they didn't have
So,
access to they didn't have communication with the migrants.
so here's the thing. I think again, because they did not have the kind of infrastructure ready, or again they did not foresee it. They could not build the entire infra where they knew ki people are going to not just call them and tell ki, "Hi, I'm at this place. Get me help." So maybe they must have thought that that is how it will serve them, but they did not have the apparatus to make sure that, ha, I'm going to receive a call from X place for a help at Y place. So how am I going to cater? So this know-how was bridged by these law students here.
And how did you find out that they needed help here or this was required?
So again, I guess social media is
Networks.
the kind of a tool where you just see a call for help or call for volunteers and you just sign up and you say, ki, yeah, just let me know what is required of me and I'll do it. So that is how it happened. And still
And
in
these calls,
touch with, yeah, I'm so sorry.
and these calls for help come from government handles.
Uh, so in my case, it was from a few different university-based organizations, student-run organizations that had in the first place reached out to these public authorities that we can help you in XYZ way. So precisely that.
Hmm. We're seeing how much is being done by civil society organizations, by students who have been facing so much of backlash from this government. I mean, practically the entire pandemic to a certain extent has been managed by people like you and the organizations you are working with, the ones coming together. So it is, again, not much to say of this. Um, Now, I think you have in part again answered my next question. But how can one start to volunteer? Since we have a number of young people listening to us right now, how can they start to volunteer? Where to start?
I don't think I'm the right person to be able to answer this question because in my case, uh, so in general, volunteering is a difficult task, is what I can say from my experience because uh, you might think in an ideal situation that you put out 2 hours of your time from your convenient timing as a time for volunteering, but that is not necessarily how things have been working, at least in a situation which is so dynamic and you don't know, like there's a lot of uncertainty, right? So because of that, there's so much uncertainty, sorry, because of which you do not know what kind of help and at what time you have to do. But in terms of just to devote 2 or 3 hours of your time for any specific uh, volunteer voluntary effort, I think there are a lot of organizations that I had first started off with. Say, uh, there's this organization based in Hyderabad called EFI. So
Why have been one of them?
yeah, yeah. So that is how actually I had reached out at YF also, that I did not have a lot of things to do. So I think I reached out to Sudhanshu that I can help. So I started off with doing the election tracker work, and then I told him that I have a lot of like further time on my hands, so I could do something else. So it's a loop of a kind where once you get into it or you understand or you try to do something, you just figure out that you have anything else also to do. So it's just a loop that once you enter, you get a lot, but it's also difficult to come out of it, I feel. So still understanding how this works. So yeah.
Right. So anyone who's looking to volunteer should be aware that once you are in it, you have certain responsibilities. You have to stay with it. You
Yeah,
cannot
because
really withdraw at any point you want.
exactly, because there are times where like largely everything that has been happening for a year now has become a question of life and death. So in such a situation, if you're volunteering, it's very difficult for something to be part-time of sorts. So yeah.
Also, volunteering is no longer a part-time thing when it comes to life-threatening conflict situations, right? It becomes more like really an obligation of sorts. Also,
Yeah, you see.
I thought you were going to say something. That's the reason I stopped.
No, so I was just thinking, so even I have personally not been able to completely understand as to uh, how volunteering works, because for me it was something of this sort where I personally couldn't see someone suffering, because it started off when I thought ki my suffering or my problems are bigger than the world. And these things just with every passing day, they just humble me further ki anything that I thought troubled me so much is nothing in front of everything that's been happening. That does not mean that I'm trying to belittle what I'm facing, but to just acknowledge that there are bigger problems to which, in my capacity, despite any problem that I have, I can definitely help. So, yeah,
It comes from a place of empathy.
yeah, precisely. Like largely, that is how it works.
just letting everyone know that we'll be opening the floor to questions in some time. So in case you want to ask a question, do drop it right now or in the time that follows. And uh, so, so back to you, Ricket. When one starts volunteering, should one identify a cause that resonates with them, or do you volunteer for the sake of volunteering? That is, do you have a particular cause that you are looking at, or is it just volunteering in itself that should motivate you, to draw you in?
So again, this is something that I'm still figuring out. So in my case, it started off as a getaway because in the kind of atmosphere or environment I was in, like the school, I did not quite understand formal education because I would even fail in subjects. So I did not know what to do and how it would help. So it did not make sense to me. So volunteering was a getaway where I first volunteered at this triathlon as a volunteer who just wave and tell people ki this is the direction you have to go in and not the opposite direction. So there's something or the other that I took away from every instance, and it was more or less an experience of sorts. Where if I did not like a volunteering experience, I made sure that I did not go back to that place or that kind of a field. But if I liked something, I made sure that I did more of it. And even if I got exhausted of it, I came back and again I came back. I went to it because I just liked the feeling of it, and it was a very nice getaway. So I just wanted a getaway. So yeah.
Mhm. And did you identify a cause at any point, since you've been doing this for a year now? Did you at any point notice that, say, youth participation in politics is something I really resonate with and I want to do, or is it conflicts or natural disasters, or did you have any such thing you focused on? Because there
So
is so much, so much scope to volunteer.
yeah. So again, although volunteering in, in calamities of different kinds is something that has sadly become an experience of sort where you've gained a lot of it, so you might be considered as someone who could help better. But
Mm.
uh, I was a volunteer with the district election commission at a sensitive polling booth. So, and elections is something that I was always interested in, like just from at the sight of seeing it. So that is something, although 8 hour experience that I had, that is something that I just want to go back to. Like that's something I just want to dwell and live in. So that is something that I like because no one would want to volunteer. Or I mean, I don't want a situation to come where I have to volunteer for a calamity or of anything of that sort. So yeah.
And since again we're all young people present here, did you have support? Do you have support from your family too? Because you spoke about the crime branch situation and then this election situation. So it is very close to politics, and elections are also sensitive matters. So do you have a support of family?
I guess in a way because they don't stop me from doing what I'm doing, but there is no explicit support of sorts. So I don't know how it works, but this is how it works.
Yeah. Okay. I understand. No obstructions. You can do what you want to, but in I mean, in case something happens, I think they will still stand by you because of this whole um, the call you received from special crime branch.
So they still
That's
don't
too
know
much
about it.
hypothesis. Oh, okay, they don't know about it.
Yeah, so I hide this kind of situation from them and tell them of about the general part that I worked with an organization for so and so period and we're doing this, and I ended there because the moment these details come out, it can get bad, and I can hide it. Like in my situation, I can hide it because again, honestly, like I told you earlier, I acknowledge the privilege I have, and being a male individual, matlab, that helps me in a way. So yeah.
Mm. And last question, Ritik. Are you still doing COVID relief work? Um, the status right now, what is it like?
Uh, so, okay. So the situation right now is that you do not have those number of COVID cases right now, but your black fungus and post-COVID complications are on a rise and on a significant rise. Where uh, one thing is that you do not have those drugs available for black fungus, liposomal amphotericin B, that is the medicine, and you do not have that available readily. Like even despite the fact that the governments have regulated it, it's not available. Like they say that you have to write an email to them and then you'll get it, but people are not receiving a response for 4 days, and those are in a way life-saving medicines at this time. If God forbid someone is infected with black fungus, and to not get those injections for 4 days straight can be fatal. So that is something that is on the rise. And the second part is your post-COVID complications, where a lot of people are on ECMO support, ECMO, and they require a lot of blood transfusions. Like there's these couple of cases that at a specific hospital that I'm catering to for 2 weeks now.
Mm.
One of them has been transfused with 63 units of blood or blood components, and the other has been transfused with 42 units or something. So to get to source in so much of blood, and again, 63 plus 40, like roughly 100 units for two individuals itself, it's overwhelming because you do not have a lot of eligible blood donors right now, because you just had the peak and any person you reach out to is in a way ineligible to donate, because either they just took their vaccine dose, or they're in general not eligible to donate blood, or they just recovered from COVID. So they have to wait out for some time. And uh, the patients, their blood transfusions cannot wait. So that is something that I am seeing on the rise right now, at least in Hyderabad.
Mhm. Also, yes, well, you mentioned that you are catering to two hospitals. What is that?
Uh, so here's the thing. A lot of patients in Hyderabad, or at least quite a few significant number of them, were brought here from different states or regions. And these two patients that I spoke of, they were airlifted from a different state altogether. And they do not necessarily have the kind of know-how here as to where they can figure out something like, say, blood donations. Because to get something of this kind, well, to have someone donate blood for you, it usually helps if you have a circle of sorts. Ki, you know people, you have a social circle in a place. But for someone who's come from a region like Jharkhand or say Bihar to this place, where the language also changes and everything is different. So I just told them ki I'll take care of this part and you can just stay there. And in one case, the patient's attendants were also not here. So my number was is currently floating everywhere as their attendant. And I receive the calls for them and I go to the hospital, get blood donations done and platelets if it is required done. And then I come back. And again, I go tomorrow to get a few blood donations for them.
That is huge. I mean, it's almost the equivalent of being the primary caregiver, and almost like family, right?
I,
I'm really taken aback. I mean, I've spoken to Ricket before. We've been speaking over the past 1 week planning this, but these are things even I am realizing right now because I mean, he didn't mention that. Somebody else might have, really spoken about it, but he didn't even mention that to me. So thank you so much for joining us, Ricket. I'm looking at the question box right now. The question box is the chat box. We don't have a separate question box here. Um, mm,
uh, so about the question on app like that has been sent to me. So there's this question that I have about someone having designed an app for people affected by disaster. So in my personal opinion, anything that comes with a social user interface, like virtual interface, hasn't been of any effective use per se. I have only seen these apps being made in huge numbers, these websites being floated, or a lot of these things, but they they cannot stay at the kind of uh, like it is very difficult to have them keep up with the ever changing situation in a country where people are not, you do not have the levels of literacy. Digital literacy again is a step above that. So to expect digital literacy at this level where anyone and everyone is affected is a hard task, and in such a situation digital apps or anything of that sort, I doubt that they can be of help. And so far, I have not seen any help from them. And even if they can be of any help, and that's only for like 5 to 10% of the privileged individuals. But again, the people in need is of a very different nature. So I don't think if it will work.
So apps in general are not useful. I mean, these websites. So I mean, I assume that these websites might be useful. There were all of these COVID resources websites and spreadsheets going around, and they were also being updated. So was that not useful on
So
ground?
here's the case with most of these resources, especially in this kind of a situation. They would run out of availability in a matter of minutes because that is how bad the situation was. And at least in my personal experience, any kind of sheets that I first went to or started dialing, I didn't get any help from them. And after a point in time when you see or notice key it is not helping, you stop reaching out to them, or at least that is what I did. So they did not inspire a lot of confidence in me. So I don't know how it will work.
Mm, right. So what you were doing on ground was perhaps much more useful, much more effective than someone sitting behind a laptop screen managing a database.
No, so I don't think how appropriate or right that would be to say, because even I, for once, for a significant time, I was also doing that with the plasma resources. But again, that's the thing. Apps or these things cannot be a blanket solution. And once a solution is shown to the people in general or the masses in general, they consider it to be a blanket solution because, again, you do not have that kind of understanding or literacy for people to scientifically understand. So these things have to be taken with a pinch of salt, right? And I don't think it works in this time.
Mm. So we have a question coming in from Chandni. A study by local circles noted that 55% of those who got a COVID ICU bed required some kind of caste links. Can you comment on the caste demographics of volunteers and beneficiaries? So, as in, was it easier for upper caste to secure a hospital bed? Did you notice this on ground, a caste hierarchy?
So I I cannot specifically speak of caste because I actually did not uh, think a lot of that aspect. Uh, so primarily the thing is ki after a lot of reading in the past 3 4 years, I have become habituated to be able to identify the caste demography of a person. So, but still, that is something that it's just struck me. But one thing I can completely assure is clout and privilege did help, because in a few cases where XYZ needed a ICU bed on an emergency basis and everybody had turned down, they picked up their call and they dialed a couple of hospitals which have been turning away patients from the doorstep that they do not have beds, and they could get it. And this was precisely the case in Hyderabad. Like, at least of all the places I can speak for Hyderabad, that if you had clout and connections, you could get beds in these 6 or 7 top hospitals, which even on the dashboard, which showed availability for a lot of hospitals. On the dashboard also, these hospitals showed zero availability. But if you made 2 to 3 right calls, you could get a bed there. But again, that was it was like those hospitals or those beds were only made for them because nobody else could afford it. Like, I know people who have had to cough up to 1 CR for their treatment, and someone like me, or even so again, I mean, even I come from a privileged background, so I think for once, even I could somehow manage to afford it. But someone who just earns hand to mouth and was rather infected with COVID because of some other careless, privileged individuals, they could not, and they had only and only government hospitals to go to, and even they were full. So I think the number 55% would be much higher than that.
I think even if we do not speak about caste explicitly, caste might just come in the form of, better financial access. Upper castes are generally, they have more access, they have more networks. That is where caste might come in. So even if, I mean, Brickett is not a researcher. This question might be better suited to a researcher or a scholar. But even as someone working on ground, what he said really makes sense that if you do not have 1 crore with you to get treated, um, there is no resort.
To just club this question with the next question on rural India.
Uh-huh.
So again, rural India is not on Twitter, and the kind of queries and SOS requests you got on Twitter 3 weeks ago, that was when urban India was reeling under the pandemic, and right now, relatively, the things are better. And right now, you do not have Twitter reeling with requests. But if you go to a district hospital in a rural area, even there, although the thing is, they do not even have resources, right? So the situation is that bad there that there is a mysterious fever that is doing the rounds, and people are passing away because of that. That is the kind of impression there. Like, so I come from a place in Gorakhpur called as Bharvalia. The village is called Bharvalia. I know 7 people who've passed away, and this was just immediately after the panchayat elections. And for them, it is not COVID; it's just a fever that took them away. So that is how bad the situation there is. कि people are not even thinking of resources because they know कि वहाँ पे क्या हालत है हॉस्पिटल में, या फिर हॉस्पिटल है भी नहीं तो.
So if someone does not have access to these resources, I mean, to hospitals and medicines and doctors, what are they doing? Do you know what they are doing? Because I was following a journalist who was reporting in Bihar, and apparently chemists were, they were supplying regular medicines, regular fever the paracetamol and these basic medicines that we consume for pain relief, and that was it. So, do you know of any such thing that इसके बजाय और क्या किया होगा?
So the thing with these rural places, even now, like even in 2021, is that they do not have primary healthcare centers, even in the villages. And to go to a hospital, like from in the place where I live in, if someone needs uh, emergency healthcare, they have to go 35 kilometers away to Gorakhpur city from Bharvalia. So that is not even in question. And your best bet is the Jhola Chhap doctor who sits on the street with a table and a chair and a white coat on his chair. You go to him, he gives you Crocin and 2, 3 other such medicines, and you return back home. So that is the healthcare model you have in the remotest of places. Like, at least this is what I know and I witnessed, like in the past 1 month, where someone I know or my family knows had to reach out to them and come back home. And on call from places like here, my mother rather would tell them ki this is the kind of proning technique that you can try. And yeah, matlab, that is the healthcare service they receive.
So we have a question about. I want to understand if we can institutionalize some of the voluntary actions taken by groups for long-term impact. Can we make this into an institution? I think civil society organizations are institutions, but what you have been doing, perhaps specifically.
So I understand that by institutionalized they mean they becoming a part of administration. But like you said, they are an institution in themselves. I think what would serve better would be a bridge between the actual administration and the civil society, which has been non-existent at least for quite few months now.
So a bridge, but what is this? I mean, what can this bridge be? The administration is supposed to be a bridge, right? They're supposed to have local officials who are supposed to act as the bridge between people and higher administration. But because they have not been working, and because people, local volunteers like you have been working, is there some kind of a system or a body that can be formed?
So one thing is that they are understaffed in general,
Who's
and
understaffed? The government.
yeah, the authorities in general, like hospitals in other places, like even in Hyderabad or maybe, uh, I think again I can speak of my native. In one of the hospitals, 10 kilometers away, you have three defunct ventilators, or rather, ventilators are just kept there. But the problem is they do not have anyone who can operate it. And if you want someone to operate it, you had to employ someone beforehand. So there is where you first failed. And second is an opportunity that you get through civil societies, because that is the work I feel civil societies usually do to bridge the gap. So yeah, I think I forgot the question. So sorry.
Is there something we can institutionalize, some body we can form? I mean, can civil society like can NGOs come together like they already have for the Hyderabad floods and make one body like some kind of Hyderabad civil society
So
organization?
that is difficult because I think having multiple organizations in general is the that is how I think it works technically, because not everyone can have an expertise in XYZ area. And if they become a blanket organization, that leads to centralization. And in the kind of work that these civil society organizations do, they're decentralized, right? And that is why they work. So to bring them under a single umbrella will cause the problem again, which the governments look at civil society organizations to serve. So one thing that maybe could be done is to equip them with resources. Like I know a lot of individuals in Hyderabad who are serving food for the needy, and for that they have to crowd fund. So, and in terms of at least uh, food and other similar resources, the government does not have any kind of uh, shortage, at least in uh, Telangana. Like, in fact, we have had the second best record production of paddy. Like, the state has beaten its own record in food. So, that is somewhere you know that you have untapped resources. So, you could pull in there here that you provide these resources to people, and people in turn give it to the masses who are in need. So, this could happen, but I have not seen this happen.
That's really ideal. But this really appalls me, that we are the people paying taxes, we are the people making donations, we are the people, running these crowdfunding campaigns. I don't know what the government has really been doing. Um, we have another question from Aryan. We know the pandemic had a massive health impact on literally everyone. Do you think the authorities are taking any initiatives to make people feel more confident, comfortable, and safe? As in, been is something happening? Do you know on ground?
So this can be from two perspectives, I think. One, for the people who are actually facing the infection, and second, the people who are facing the problem because everything is shut down. And for the people who haven't faced the infection, uh, again, there's literally no mechanism in place, like institutional mechanism in place for mental health. I mean, so again, that is something that is not existing. And even if you speak of people who are facing it, like they're facing the infection, uh, the attempts were made to at least keep a check on them. Like I know of uh, three friends from Delhi and two from Kerala who would receive these calls from their local authorities, and even ASHA workers would go to their house. And the places where they live in or where ASHA workers are deployed, there you do not have an acknowledgement or understanding of mental health or emotional health. So just knowing that someone is visiting even in this way helps them कि हाँ कोई है मेरे पीछे खड़ा, like someone is standing behind me. So that can work, although the product that you would be looking at would not be mental health, but that helps in a way. But in a larger scheme of things, in urban areas at least, it's non-existent, and I think that should be the next focus, or rather immediate focus, where people are losing their uh, sanity. I mean, I have been in a situation where it just felt like uh, throwing anything that comes in front of me, and that is not again something that is in rage, but because of frustration. So again, like I said earlier, there's nothing to say because you do not have anything in place, right? So
Mhm. Right. So our needs extend beyond just, these physical ailments. It's also mental health, which really feels far-fetched to even ask for at this point. I mean, taking one last question, which is coming from Rishika. Uh, where is it? Yes, do you mind shedding some light on the political potential of social media? I mean, it's rife with barriers to access and often tends to evolve into echo chambers that do not lead to good discourse. Yet it turned out to be a vital resource for mostly urban populations during our peak. Going forward, how do you think we can, make it? How do you think we can use it better? I've lost the question.
yeah, so what I've come to understand about a place like Twitter, because that is largely the only medium I use, is that uh, it is a virtual interface of your community. Like if you, let me give you an example of a place like Bharvalia where I live. You have these 12, 13 houses where people meet on a daily basis, or someone from one house comes to X house and they speak of something, and that word spreads. And in a time of calamity or something that a person is facing in a particular house, all the other houses, despite any differences, they reach out to them. So I think a medium like social media, or even Twitter specifically, is that kind of a medium, or rather has become that kind of a medium. And that is how it is being utilized. And in terms of uh, channeling it, I doubt it is possible, because when it comes to humans using something, uh, channeling it will happen only when a specific human does, and you're talking about numerous individuals. So I don't know how that will work.
But is there a way we can use Twitter better? So what I noticed during the second wave is that people were putting out requests. So there was one bunch of people who were putting out requests and some people who were putting out leads. Is there something better we can do? I saw some people using this tech solution where you put in some certain tags and you get what you are looking for. It was entirely technological. But is there any other thing can social media platforms do something more?
No, so that is like I told, ki in the end they're used by humans ourselves, right? Like by ourselves, right? And they're only becoming a secondary medium of the reality that we are in. Like the community example that I gave you, that is precisely what those mediums are also doing. And uh, in terms of expecting better, or rather to be used in a better way, you say that, I mean, or rather the question itself comes of being used better in a situation where you're in dire need. But is that not something that happens also in a community where people in general, matlab, there'll be a lot of argument or misunderstanding. But when you know that it's a time of crisis, people pull in automatically. So I think that is how Twitter also works. And I don't see something of that sort actually happening. Matlab, there can be efforts put, but it'll spiral back to the status quo, I feel.
Hmm. So how we're working right now is just um, the most effective we can be. I mean, there is no real
Yeah,
scope to go from here.
like us working, that is the most effective way I feel.
Hmm.
And because the onus is on the state. So yeah.
Right. Thank you so much, Ricket, for joining us today. For it has been more than an hour-long conversation. It's been 1.5 hours. Thank you so much for devoting this time. I know you keep busy. Thank you so much. Thank you for joining us, everybody. And that is all. Thank you very much.